Hi everyone, my name is Tim Collison. I work for the Leprosy Mission Australia, particularly with supporting churches and volunteers and helping people think about how they can make a difference for people affected by leprosy. I know you've been experiencing the impacts of COVID-19 in Australia. I know that if you're in Victoria and now in New South Wales, you're starting to experience it all over again in some ways. But we also know that you have a heart for people affected by leprosy in the countries that you support through the Leprosy Mission Australia. And I also know that you have a heart for the people in those countries who don't have leprosy. And so we wanted to get a perspective on what's happening in one of those countries. And so we're speaking to Preeti from Nepal, and she's studying in Adelaide, and she's really kindly given up some time to help us think about what's happening in Nepal and how it's impacting Nepal and how it's impacting people affected by leprosy. Um, Hi, Preeti, how are you?
Hi, Tim. I'm doing well, thank you. How are you?
I'm doing well. And so you used to work for the Leprosy Mission in Nepal, didn't you?
Yes, I worked in Microbial Research Laboratory for about 4.5 years.
And what did your role there involve?
I was working as a research technical officer, so I was involved in developing research proposals and implementing those research projects and maintaining databases. And in the meantime, like I used to talk with patients as well for
Yeah.
collecting data for our research projects.
Oh, that's really great, Preeti. And I've had the opportunity to visit the lab, and they do some really exciting work and work hard to understand leprosy better. So it's great that you're involved. And you're in Australia now. What did you come to Australia for?
I'm here to study Master of Public Health, and I'm studying MPH in University of Adelaide.
Okay, that's great. And have you been enjoying your time in Australia?
Yes, I love Adelaide.
Oh, wonderful. It's a really nice city, isn't it? A shout out to
Ye-
Adelaide who's watching.
Yes, it is.
And so I guess what are some just in terms of COVID-19 in Nepal, what's the impact been there?
I think the COVID-19 has a greater impact on leprosy affected patients because like we have few centers where we can get medicines, and if there is no access to health services and if all the transportation is halted, then even there is health centers in rural villages, then the patients are not getting medicines. They
Yeah,
don't
so
have an
they
access to medicines.
okay,
And
so because they had a lockdown, the patients can't get access to medicine now.
yes, not only that people can't go to the health centers, it's mainly because the health system cannot supply the medicine to the rural health centers because there is no transportation.
Okay, so the lockdown, like in Australia, we've had not to the same impact, but Australia Post has had delays because there's like New South Wales and Victoria and South Australia have all shut their borders now. So
Mhm.
while there's a similar impact, but it's kind of affecting the medicines getting to people who need it.
Yes, because the lockdown definition in Australia and lockdown definition in Nepal is very, very different.
Oh,
Lockdown in
okay.
Australia means there are public transports. But in Nepal, lockdown means there is no public transport at all, and even the people who have their scooters or their motorbikes, they cannot go and ride it because they are not allowed to. Only few people with the uh, access to go to the hospital, such as doctors and nurses and few journalists, they had a pass to ride the vehicle outside. Other than that, all other people have to sit in the home. They cannot come out.
Okay, so it's in Australia and then Victoria where we're back in the lockdown. We're allowed to
Mhm.
leave the house for medical reasons, for exercise, for work, and for shopping. But you're saying in Nepal the lockdown's even stricter than that.
Yes, it's very strict. They can get groceries in around the shops, but they cannot get vehicles or go in their own motorbikes to to get the groceries. They are
Okay,
not allowed to get into the transport.
okay, wow. And so that then means that there's been a big impact on the economy as well, I'm guessing, for people in Nepal.
Yes, it has. And I think the most impact is with the reaction patients because they don't
Yes.
only need the medicines, they also need the immediate medical care from the doctors and the dermatologists. So the most impact is with the dapsone hypersensitivity patients and
Yeah.
the reaction patients. Because
So for
if they
people
don't,
who not everyone knows what reaction is, do you want to just talk about it a little, just so supporters who might not have heard about it have that awareness?
Reaction is a immunological complex, and about 30 to 40% of patients who are diagnosed with leprosy had reactions, and reactions may occur before the leprosy diagnosis or during the treatment or years after the treatment as well. And it is not only like peripheral reactions, it also hits the systemic uh, organs like lungs, kidneys, liver. And it has, there are two types of reactions: type 1 reaction and type 2 reaction. Type 1 reaction is generally mild, but type 2 reaction is generally severe with a lot of nodules and fever.
So basically, as a result of having leprosy, about 30 to 40% of patients will have their body has a reaction to that, and it can cause
Yes.
pain and inflammation, and it can be, from my understanding, really painful for people. And so making the point that they really need access to treatment, but the lockdown means that they can't access that.
Yes, and I think last week I was talking with the lab manager in Nepal, and I asked him like how the patients are coming to the hospital, and he said like one of the patient who had a reaction, he came to the hospital in an ambulance and he paid around like 20,000 Nepali rupees. It's around like 250 US Australian dollars
Oh, wow.
just to come to the hospital for the treatment. And it's like,
Because he was in so much pain.
yes, we can think of the severity of impact with this one example as well. It is
Yes.
only the tip of the iceberg.
And because the average income in Nepal is quite low, so that's a really high
Yes.
to pay 200 for an
Yes.
ambulance. And I think that's an
He,
example of how severe that pain is then for people.
yes. He came to the hospital because he can afford that money. And like we can think for the patients who cannot afford that money, like what are they
Yeah.
doing? Like
What are they
we
doing?
don't,
They're just
yeah,
suffering.
we don't know anything about those patients. We don't have any data. We don't have nothing about
Yeah.
those patients.
And I know that they've been working hard there to try and help people with food who need it, because I know people affected by leprosy
Mm,
are able to work, like a lot of other Nepalis during the situation
mm,
haven't been able to work because of lockdown. I know the Leprosy Mission Nepal has been working hard to try and get some food parcels out there.
mm.
Also trying to arrange medication and access for people who need it, haven't they?
And it's very hard for the leprosy mission itself as well. The leprosy mission Nepal, the
Yeah.
hospital, it's difficult for them as well because there is no general patients there, so their income is cut, and even with this donations, like the overall donations is also getting low this year as
Yeah.
those last years. So it's more difficult for the hospital itself as well to for the administrative cost and to provide services to the people who are in need.
So
And this is
yeah.
and this is the time where when there is a higher need for the patients, and this is also the same time that the funds are being like a kind of like lesser. Yeah, the funds, even the hospital
Because
income is
usually
lesser.
the Leprosy Mission Nepal raises a lot of their own funds in Nepal through who don't have leprosy paying for services and through donations
Yes.
from lay people, don't they?
Yes.
In essence, they work with the funds from Australia and England and Wales and Northern, a whole lot of other countries. And that funding has continued. So Leprosy Mission Australia, Leprosy Mission England, Wales, we've all continued our usual funding, but there's been impact because a lot of those usual sources of revenue haven't been able to happen because of lockdown, isn't it?
Yes, and it's not for 1 or 2 days. It's been for 3 months.
Yes. Do you know if they've increased the lockdown? Like, have they set a date when it will end? No.
There is no fixed date that when it will end, but I think they have just started to run the public transport from today or maybe tomorrow. So I think there will be more movement, but they'll have to follow the strict guidelines. And if they don't follow the strict guidelines, then the coronavirus number is already increasing, and it's might more increase.
Because in the first couple of months, it was actually quite low in Nepal, the coronavirus.
Yes.
And then they rose up again. Why was that? Do you know?
I don't know much about that, but as per I read the news and the articles from Nepal, they said like there were people immigrants coming from India to Nepal, the Nepali workers who went to India because they didn't have work there as well. And when they came back to Nepal, there was no proper quarantine and no proper recording system of those immigrants.
Okay.
And might be
that's
those
a question of resources. Like Australia, when people came back, we were fortunate the government paid for them to stay in a hotel for 2 weeks.
Mhm.
Although now we do know that you have to pay if you come back for the hotel yourself, but they enforce that quarantine. We don't have land borders with any country, whereas in Nepal,
Mhm.
long border with a few countries. And so as people, a lot of Nepalis work in India, don't they? And they just came back
Yes.
to work because India had lockdown. And so I think people are thinking that that meant that the cases in Nepal started to increase.
Yes, as per the news reports, like it is one of the reason to
Yeah.
increase the number in Nepal, and also the like inter-district borders were not closed properly before, and though there was no transportation, but the people were coming to Kathmandu and other places from those southern belt.
Yes. And so I think at the moment there's a campaign going in Australia called End COVID for All, and it acknowledges that COVID is a problem in Australia, but it also is saying that unless we can help people who have COVID and end COVID in countries like Nepal and India and Sri Lanka and all around the world, it will still be a problem for everyone, including in people in Australia. So they're really saying they're really wanting the government to help other countries respond to COVID in ways that will really help their people. Like, so not all countries are blessed to have the resources Australia have. Do you think that makes sense to you? Like, you've worked in medical research and you have an understanding that if we don't end COVID for people in Nepal, it won't really end anywhere, will
It won't, because like with the fast technology and with all these things, the world is very small. We can see how soon the COVID spread all over the world. So
it?
if we
Yes.
don't control it in Nepal or some other developing countries, then it will not be controlled all over the world. Like,
Yeah. So we want to help people because it's good to help people, but we also know that if we help end COVID for all, it has a benefit for Australians as well, doesn't it?
yes, definitely it has.
And how do you think Australians could make a difference for people in Nepal with leprosy at the moment?
Maybe the first and foremost thing is to provide the financial support to
Yes.
the organizations such as the Leprosy Mission Nepal, and launch new projects that focus especially on the COVID affected leprosy patients.
Yes. And
Like,
a great way to do that is you can support Nepal through the Leprosy Mission Australia. You can, if you make a donation through mail, check, online, or over the phone, you're able to say, I want this to support the projects in Nepal. And then that money does get sent to Nepal. So that's a great way to make a difference. And do you think writing like your local politician in Australia and saying, look, I want to encourage you to think about the End COVID for All campaign can make a difference as well?
yes, that can make difference, because not only with the financial help, the government can also help with the resources, or what worked here in Australia that can be customized in Nepal, not implementing the same things, but they can provide it the resources, not the financial resources, but the expertise as well, like how to
Yes.
curb leprosy in Nepal.
Yeah, and I think that's a great way when we can encourage those big responses. And I know the Australian government's had a good response in helping some other countries' supporters help. Like
Mhm.
Timor-Leste, the Australian government has worked really hard to provide extra COVID-19 tests and expertise. So I think being able to share that with more countries would be really great. And you can always encourage your local politician by writing an email to them to encourage them to raise that.
Yes.
From my perspective, I think praying for people affected by leprosy is really important, and talking to your church,
Mhm.
saying, how can we make a difference as a church? Can we do a collection for people affected by leprosy in Nepal? Can we take time to pray in the service? I think those are also really good steps that you can take.
Yes, definitely.
Preeti, I really appreciated you taking time to share with us about the impact of COVID in Nepal. Is there anything you'd like to add as we finish up?
I would just like to say, like, please help however you can, either through donations or through your prayers, because people affected by leprosy in Nepal is like more affected by COVID as well this time, so they need more help and more prayers than usual.
Well, that was really great, Preeti. Thank you for that. I really appreciated talking to you.